All right, I'm going to go ahead. We saw people joining, but I'm going to go ahead and get started because we have a jam-packed session today, and I want to make sure that we get everything in. Welcome, and thank you for joining us for a conversation around supporting children with disabilities in childcare settings, and joining our Building Blocks of Belonging, Inclusive Childcare for All webinar. I'm Troy Hunter. I'm the Director of Research Evaluation and Performance at Groundwork, Ohio. Just a few housekeeping items for today. Today's webinar is being recorded. Closed captioning is available. All participants are muted. Please use the Q&A chat for questions. We have a full agenda, so if we can't get to your request or question during the event, we will follow up after the event and if you provide your email address with the question, and all participants will get a recording of the webinar along with materials shared via email after the event concludes. We bring an impressive lineup today to discuss challenges facing children and families with disabilities. We're going to hear from Ohio Promise, who's working to make childcare accessible and inclusive. We're also going to hear from DeSacco and Cincinnati Children's about some innovative projects happening in Ohio to support children with disabilities. And we're going to finish our discussion with a panel of experts and a parent advocate on how we can work together to establish the foundation for strong, inclusive childcare in Ohio. Today's webinar is brought to you by Groundwork Ohio. Groundwork Ohio is a committed, nonpartisan public policy research and advocacy organization formed in 2004. We are celebrating our 20th anniversary this year, and we're really excited to jump in to our webinar series. And this is our inclusive childcare webinar is jumpstarting us for the year. We work hard to advance quality early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. Please follow Groundwork Ohio and our presenters today on social media and visit our website for more information. We would like to express a special thanks to our funders and partners, W.K. Kellogg Foundation and the Cleveland Foundation. We have a couple representatives from Ohio Promise today that are going to talk about the newer program and kind of what's happening in the state around Ohio Promise right now. We have Laura Maddox, who is the director of the Center for Young Child and Early Childhood Inclusion Center for Excellence at OCALI. She has experience as an educator, administrator, researcher. She has directed federal and state grants and contracts related to children and youth with special health care needs, children, youth, and foster care, and healthcare coordination in early childhood education and autism spectrum disorder. Also today, we have joining us Kathy Muehlbauer. She is the Child Care Policy Supervisor at the Ohio Department of Children and Youth. She has been in early childhood care and education field for 27 years and has been in the Bureau's policy unit since 2005. We're excited to have both of them joining us here today. Thank you, Kathy. Thank you, Laura. And I'm going to turn it over to you.
Good morning. As Troy said, my name is Kathy Muehlbauer, and I'm with the Department of Children and Youth, which is our newest state agency that encompasses all the agencies that serve children. So it's a very exciting endeavor in and of its own. So we're really excited to be here, and I'll let Laura introduce herself, and then we'll get started.
Hi, good morning. I'm Laura Maddox, and as Troy said, I am with OCALI with the Center for the Young Child in the new Early Childhood Inclusion Center of Excellence. Thanks, Kathy.
So as some of you may have known, there is a new initiative in our state, and in October, Governor DeWine issued a press release launching Ohio Promise. This exciting and wonderful new initiative, as it stands on the slide, tells us that we're going to promote resources, opportunities, and meaningful inclusion through support and education. And today you'll get to hear a little bit about how we're going to offer these services to families in Ohio. Next slide. Thank you. So as I was saying, Ohio Promise has many pillars underneath it. This is just a small amount of those. Some of you may have been following our child care manual procedure letters that our agency posts in our child care manual. And we offered in the beginning a newest credential that is for professionals, and it is an early childhood inclusion credential. So that was one of the very first things that we did. This credential will also be growing over time, as you will see very, very soon. We also introduced a new program designation that is on our childcare webpage. When you search for early care and education programs in our state, If a program received or obtained this new credential or this new designation, it will show on our website. And there are requirements to obtain this credential, which I'll talk about, or the designation, sorry. We also have the Center of Excellence, which Laura will go over here briefly in a few minutes. And we also introduced a new scholarship program, and I'll talk about that too. And we also have a state advisory team that has numerous families and family advocacy organizations, as well as state leadership team members and local providers, as well as other nonprofit organizations that help serve our state, helping to get services to families. And it's got a really good team on it, so I'm excited about that. As I said before, the Professional Early Childhood Inclusion Credential was created so that programs could obtain more training, more education on inclusion. And it's really open to anyone that works in early care and education. And like I said before, we have launched level 1. We are now getting ready to launch the level 2. It should be sometime in February, so watch for that. And we will be implementing a level 3 later on. I also mentioned on our childcare web search page for early care and education programs, which this also includes searching for the preschool programs and school age programs previously licensed by the Ohio Department of Education, now will be under the Department of Children and Youth, as well as day camps, in-home aids, and the licensed childcare centers. We launched this as a new way for parents to be able to look for childcare for programs who have achieved, excuse me, the designation. And as I said before, we issued some procedure letters on this that had all of the requirements you needed to meet to get the designation, which we're excited because we have a lot of programs who have the new designations. It's very exciting. We also offered some financial incentives in the beginning to try to get programs to really obtain the new credential and get the training and the services from the Center of Excellence. Those requirements are also outlined in the procedure letters. But as you can see on the slide, some of the programs that had already been working with children with disabilities and special needs who were receiving publicly funded childcare also at the time were getting an enhanced rate by our agency. So we went ahead and gave all of those programs a one-time initiative, financial incentive as a thank you, and just to help to support their system however that we could do that. We can go to the next slide. Thanks. And then we also issued a procedure letter where we had new scholarships available for families who applied for publicly funded childcare and their child was either on an individual family service plan or an individual education plan, but they did not qualify by income. So we offered some scholarships for these families to apply to offset the costs with their program. Their program would have to have the program designation, and the family would not qualify for publicly funded childcare up to a certain amount of income. And then the program would get money to help offset the costs that the family incurs by having their child in that program. Now I'm going to turn it over to Laura so she can talk about the new Center of Excellence.
Great. So the Early Childhood Inclusion Center of Excellence was developed to focus on the early childhood workforce and to be sure that early care and education professionals have the tools, resources, training, and skills needed to provide high quality care to all children. And we also want to make sure that they have the confidence and competence to serve children with disabilities in every setting. So children with disabilities and families have access to all early childhood environments in the state. And it was developed also through, as Kathy mentioned, the efforts that developed all of Ohio Promise, really looking at a comprehensive way to address the needs of the child care workforce in the state. So our Center of Excellence priorities start with, we really want to become a foundation for statewide coordination and guidance in the state. We want to support the workforce, all of you that are out there, those professionals who work with young children in the state, with guidance that will help them build inclusive programs. We're offering professional development and training, kind of an array of services that I'll talk about in a minute, that include coaching and technical assistance, We want to facilitate cross-agency collaboration and strengthen program and community capacity. That's a really important part of what we want to do, because already there is fantastic work going on in the state. And historically, it was through a variety of different agencies. Now that DCY, the Department of Children and Youth, has come into being, a lot of those agencies have come into the same place. And so, you know, it's another benefit that can help us pull together, you know, early intervention services that are already available that help foster inclusion, and training and technical assistance through itinerant teachers and other local education agencies efforts, as well as childcare CCR&Rs and how the work that they do to help professionals in the state build inclusive programs. So we really want to build cross-agency collaboration. We definitely don't want to duplicate what's already offered. We want to help strengthen what's out there, and we want to provide support to those efforts. We plan to and are already developing lots of training and technical assistance that we are offering throughout the state. So our three primary goals are to build the infrastructure of the Center of Excellence so that it can serve as a foundation for cross-sector inclusive early care and education in Ohio, and can support continuous improvements through the state, community, and local agencies and families. We want to provide training and professional development and workforce support. And we also have extensive tools and resources that are going to be available. We'll be giving them out to child care programs, so we make sure those tools are available and on hand. We'll have things available through our inclusion support specialists, and we'll have materials and resources available that are maybe more complex equipment and assistive technology through our lending library at OCALI. And so just to give you an idea of the type of activities, type of services that we're going to offer, we'll offer just general information. We're already, I think we've already received, you know, close to 100 requests. And those requests, a lot of them are for general information, what resources are available. So we're building that information to be able to have a comprehensive library of materials and resources. We'll participate at outreach activities. So if you have local or community events that you would like us to be at or to have information at, we would love to hear from you. We'll be doing presentations and training on evidence-based practices and inclusion-related topics. We're really focusing on universal access so we can address all children. We will provide individual consultation and technical assistance, as well as practice-based coaching to professionals to develop their skills. As I said, we're doing a lot with cross-agency collaboration, and then we're also looking at the community and program level. So we're helping look at inclusive policies of programs, inclusive community teams, you know, ways that we can help build at a program level your capacity and your staff training and knowledge around inclusion. Here is a map of our 4 inclusion support specialists. These are the areas that they serve. And you can also find this, if you want to go ahead and move to the next slide, Troy. Oh, this is just an overview of the kind of equipment. I've already explained that, so go ahead. Okay, so if you go to our website at cycsuite.org/ec-inclusion, you can see more about our network. You can join our mailing list so you learn about upcoming training, and you can also submit a request for assistance and services or equipment and materials.
Great. Thank you guys for that really thorough overview. There are a couple of questions in the Q&A, and if you do have questions, please make sure to use the Q&A versus the chat. But in the Q&A, just really quick before we move on, someone asked if the PEIC is available to TA specialists, trainers, coaches, et cetera, who are not directly working with children. I believe the answer to that is yes. Correct, Laura? Great.
Yes, it's open to anyone.
Great. And then we have another question that I might If you don't have time to answer it right now, you can answer it in the chat, Laura. But how is Ohio Rise ensuring more programs are receiving their credential or being willing to serve children with disabilities?
Okay, great.
I think that might be Ohio. No, I think it's Ohio Rise. All the names are similar.
Great. And I wanted to make sure, Kathy, did you mention that the second level of the credential will be available the first week of February?
Yes, I did say
okay.
February. Yeah, it should be live, I think, the first week of February. Yep.
Perfect.
Great. Well, thank you guys for coming today and talking about Ohio Promise, and we're excited to see what comes next. Next, we have with us Kari Jones, who is the president and CEO of the Down Syndrome Association of Central Ohio. Since joining DSACO in 2014, she serves in providing strategic direction, development, and ensuring families' needs are satisfied. Kari has led DSACO to develop new statewide educational programs, Learning Aid Ohio and Adult Literacy Ohio, and has served thousands of children and adults with developmental disabilities throughout Ohio. Her primary focus is to elevate the voices of Ohioans with developmental disabilities and their families to ensure they have a lifetime of opportunities available to them. Kari, thank you. Take it away.
Hi, I'm so excited to be here. Thanks for having me. As Troy said, my name is Kari Jones. I'm here today to talk with all of you about a report that my team put together last year in collaboration with many different partners on accessibility for childcare, particularly with families who have children with developmental disabilities throughout Ohio. And just a quick overview, I'm going to plow through a lot of information, and we'll have a report available to you all soon that I think Troy is able to send out for us. But with this, I just think it's a really important quick note that when we talk about the survey demographics, we were really excited to receive a large number of responses for this survey and representing, a really wide range of ages, about half below federal poverty level of that 150% demarcation, about half above. Over 30% represented were of various races other than white. We had a huge population from across Ohio and the majority of the counties. And we had a really great snapshot of both rural and urban and suburban types of environments. So I think that's kind of an important component when you're looking at data. I think everyone talks about how data can tell you certain things, but if you're not really getting a great comprehensive snapshot that's diverse representation, that can be a challenge. Next slide, please. So we broke this down to get feedback and populated the report into really three main categories: families whose children were currently accessing paid childcare, those that weren't but wanted to be, and then families who indicated that their choice was not to seek out paid childcare. Next slide. Okay, so I'm just going to talk through a couple of data points that we found under each category and then get to some of the recommendations that we saw based on the themes. One piece here that I think is really important to know, that families who were accessing childcare still had a pretty difficult time getting to it. More than 60% were told that just by at least one childcare program that they just couldn't serve their child there for whatever reason, which we've heard that anecdotally, but to see that data point was pretty striking for us to see through this report. And another big piece that's going to be much harder to tackle, but is this perceived discrimination and negative attitudes. Over 60%, again, of families said that when they were walking into childcare programs or having, just visits at potential locations, whether that be center-based or in-home, that they felt that there was some discrimination and negative attitudes, and 60% of the families surveyed. Another big piece here is that 70% of the families said that they had to switch childcare programs. So maybe they found a childcare program and then for whatever reason, the childcare program really wasn't able to meet their child's needs. So then they had to leave. So not only is it a more cumbersome process on the front end of interviewing and visiting lots of locations, getting turned away, facing discrimination in some, at least from their perception, but then they are now having to leave and start all over again with the process 70% of the time, which we found to be very striking. Next slide. Okay, so families that weren't accessing childcare but wanted to be, the most commonly cited reason was that they couldn't find a provider that could meet their child's needs associated with their developmental disability 62% of the time. We have a lot more in our report that we can outline in that, but that's a significant number that we saw. And from these groups of families that completed this survey, another striking thing is just that over half said that this inability to access childcare significantly or very significantly impacted their ability to work, which isn't shocking. But when you think about the workforce issues that we see here in Ohio, that's a pretty big population that would like to get back to work and cannot because they cannot find a place that will meet their child's needs. So for families whose child is not in childcare and they've indicated that that's by choice, we still found it interesting that their choice was made oftentimes based on their responses was just because of a lack of trust in childcare employees' ability to meet their child's specific needs, concerns about discrimination and bullying, just concerns about safety and well-being of their child, concerns about potential abuse and appropriate approaches. So I just with my Kari Jones hat on, find that interesting because to me, that's not really a choice. That's not just saying, I just want to stay home with my child. That's because of some concerns about how, of course, there's like a fire department going by. I don't know if you guys can hear that. But anyway, I find that really telling that this is something that as a family-facing organization, we've seen a lot of over, we've heard this anecdotally for years. And so to see this in writing for us says that we have a lot of work to do, which is why we're so thrilled to see the steps that are being taken with Ohio Promise and the credentialing and designation, because we really do feel like that's going to speak to some of these really basic concerns that families have. And that's a great first step into achieving, really moving the needle for families. So we have some areas of focus here. And again, I've kind of touched on these different pieces. One that I haven't touched on so far is that a lot of the licensure, if you look at the pool of licensed providers across Ohio, many don't have licensing beyond the age of 12. And so that's a significant issue that we're not hearing discussed a lot. But when we did, really take a look at the demographics completing the survey, there were families who had children up until the age of 21. And so when you look at that gap of maybe when accessible childcare ends, oftentimes at age of 12, yet adult programs and benefits don't kick in for the developmental disability community until oftentimes 2021, 22. That leaves a huge gap of really available opportunities for families. We've heard about it a lot with summer programs and just summer accessibility, but we're really talking about after school care. And there are many young adults with developmental disabilities who are still not in a position to be left alone where a typical child might be. So that's just an area of note there. And then I'm not going to dig into all the recommendations because I've gone way over on my time now. But a couple of the recommendations off the bat are ones that are already being addressed by the state and leaders and many of the people on this call, which is thrilling. And we also do want to note that there are major barriers that families feel need addressed. A big one is, addressing behavioral supports, medical needs. Diapering and toileting is a huge barrier for many, many families whose children just aren't potty trained and are turned away. And so there are many different recommendations that we have that you can see on our full report. But I can't get into all of them right now because we just don't have enough time. But thank you so much for allowing me to share this report, and you'll be able to have access to the full report here soon. Troy will send that out for us.
Yeah, thank you for sharing all of that, Kari. And I I just want to commend DeSaco for taking the leap and providing a resource like this that's able to give us a good snapshot of the state and what's actually happening so we can address it in real time. I see some people asking if the slides will be available. I can send those out with my follow-up email, so the slides will be available because there's lots of really great information on here. Kari, if you can just answer one question before we move on. I know we're running a little tight on time, but we're going to make it work by the grace of whatever higher power we all submit to. Did you find that there were a certain age group that struggled with childcare more than others? So is it harder for preschool age versus infants?
So the really interesting thing is that no matter how you slice the data, because we could manipulate the different demographics and really compare apples to apples, no matter if you were above poverty, federal poverty level of 150%, below it, urban, rural, just by different demographics, it was almost always the same from what we saw with our data collection. So we did have a pretty equal sampling across the age ranges and did not extrapolate anything that appeared to be majorly unique to one particular age group.
Great, thank you. We're going to move on to our next section, but Kari, if you feel comfortable answering any questions in the Q&A while you're waiting before we get to the panel questions, feel free. Thank you again. So we're going to move on. Today we have with us Lisa Zimmermann. She is the clinical program manager at the Perlman Center for Cerebral Palsy at Cincinnati Children's Hospital, where she has worked with children with physical and developmental disabilities and their families for the past 17 years. Lisa and her team of medical social workers provide psychosocial assessments, care and resource coordination, and emotional support for caregivers while collaborating with a multidisciplinary team. We're excited to have Lisa with us here today. And with that, Lisa, I'm going to turn it over to you.
Thank you, Troy. It's great to be here today. In my role as a social worker with kids with cerebral palsy and medical complexities, I've often found that these families and these children are the ones who have the most significant barriers to childcare. We hear stories all the time, and so I want to start off with this slide just talking about the patients. The first slide has a list of kids who I've worked with just in the past year, who have been denied childcare due to not being able to find a childcare that can meet their medical needs. Troy, if you could, yeah, there we go. So these are 17 real people in just under a year that I've been working with who are struggling to find childcare for a lot of the reasons that have been previously described, but children who have complex medical conditions and require nursing care in order to be safe at their childcare setting really have an intense barrier to finding care. And so I'm talking about children who have trachs and vents, G2 feeding, seizure disorders, type 1 diabetes, different genetic conditions, and also physical disabilities that require a lot of dependence on equipment. So this issue in Ohio causes a lot of problems for families, including lost wages and financial instability for families. A lot of them are increased reliance on public support and immediately need to quit work and rely on government assistance. A lot of psychosocial stressors, which decrease the mental health of parents, and also the children are isolated and excluded from their peers. So the negative impact is felt by children and families, as well as employers who are missing out on workers who can't come with disruptions due to lack of childcare. The research is pretty clear about this problem for this specific population. And we also know that there's a cost to taxpayers as well as state Medicaid for the cost of care and the public health benefits that are increasing in use due to this lack of childcare. Another problem that we've been looking at here at Cincinnati Children's is the avoidable hospitalization days. In 2022, we recorded almost 4,000 days of service where patients with complex medical conditions had to remain in the hospital after the date they were medically ready for discharge. And sometimes these kids are staying in the hospital many, many days. And of course, that's causes significant mental, emotional, social, and financial consequences for them and their families. And in 2022 alone, just at Cincinnati Children's, $22.5 million of estimated costs for Ohio Medicaid and private insurers to cover those costs of those days. And these are days that children could have been discharged if there was home nursing or community-based nursing available to take care of the kids, because their families simply can't do 24-hour care, and the children require somebody to be caring for them around the clock. So you can see how we have a major problem for this population where a child needs to have a nurse with them at a child care setting. Of course, we are so excited about Ohio Promise and the initiative and all that you've heard about with Laura's work at OCALI. But unfortunately, the governor's Ohio Promise initiative so far does really not go far enough to care for the kids with complex medical conditions who require nursing services to get through their day at childcare. So we want to extend the vision, of course, as Laura said, to look at universal access and provide some alternatives for children who have complex medical conditions. So I'm a part of a coalition in Southwest Ohio that's been working on this for about 1.5 years, and we've identified a proposed solution, and we are working to raise awareness of PPEC, which is Prescribed Pediatric Extended Care Programs. They're non-residential, community-based programs that began in the 1990s in different states across the U.S. to address this critical need for medical child care. So PPEC programs are state licensed, and they often go up to, as Kari suggested, the need for increased ages. They can go up to 21. As well as the nursing services are funded, and the extra medical services are funded by Medicaid reimbursements. PPECs allow medically fragile children who require nursing care to be served in a traditional childcare setting up to 12 hours a day. So, and they are, the best models are inclusive and integrated in all ways. So siblings and typically developing peers are with the children who have medical complexities in their classrooms, and they have access to educational and social learning opportunities, as well as the provision of early intervention services. OT, PT, and speech therapies can be happening right there in the PPEC programs. They allow parents to return to the workforce or school, and they provide an alternative to home nursing, so that some children can have a nurse take care of multiple kids in a community setting where they can have that social programming. So PPEC programs are currently available in 15 states. There are also other states that don't call it PPEC but offer a very similar service. So these are the states that we know of that are currently running PPEC programs. Virginia is currently in the process, and of course down in Cincinnati we're close to Kentucky, so we've had the pleasure of being able to benefit. A lot of our families benefit from the PPEC services that are right across the river in Kentucky. And interestingly, most of those 15 states have just a few providers in the major cities, but for example, Florida has a model where they have over 150 PPEC centers across the state, so families have a lot more access in certain states. But we've worked closely with Easter Seals Redwood, which is a Cincinnati-based nonprofit that's providing PPEC services and has for over 15 years. Now they're in 3 locations in Northern Kentucky, and we love their model because they provide childcare to 140 children, and half of those kids have medical complexities. So the kids are completely included and integrated into the programs, and they're showing strong outcomes for kindergarten readiness and increased mobility and speech, and the social interactions that they have with their peers are really an important part of their growth and development at this young age. And it's important to note that in Kentucky and most of the states, the eligibility is not based on income. So children in all families can qualify for the PPEC care if they have a prescribed need for nursing care during their child care day. So our coalition has worked together with Redwood and a lot of community leaders in our Southwest Ohio area. We've written a proposal that kind of outlines all the different important pieces we feel like would be needed in the state of Ohio to adopt PPEC programming here. And we can make that available to anyone who's interested in learning more about our ideas. What we did is we looked at the legislation passed in multiple different states and also looked at what Kentucky is doing. We took the best ideas from all the states that we reviewed and put it into a proposal that we think makes sense for Ohio. The good news is so far there's been a lot of strong support for PPEC in Ohio. Families really like this idea. A lot of families like the option of having a community-based and a center-based childcare option for their child. There's a lot of bipartisan support for anything that will promote workforce participation, decreasing the need for the government assistance programs, getting families back to work after they've had a child born with medical complexities, the increased employment and tax revenue, and also importantly, reducing the discharge delays and hospitalization costs that are completely avoidable and really cause a lot of strain for children and families. And there's a lot of leadership and support from Ohio's medical providers and the disabilities community. So there's strong support in Ohio. The next slide has a list of just the community organizations that are supporting our proposal, and we're sharing the word with as many as we can about this idea. NBC did a great spotlight just a few days ago on PPEC programs in Florida, and we'll include that out and information after today's webinar. But our next steps are to work on drafting and passing legislation to support PPEC establishment so that children who have these complex medical needs and need nursing care can be included in care. The licensure is the first piece, and then securing state funding that would allow PPEC services to be funded and stable. You can see that current rate in Kentucky is $270 per day, which is actually less than what it would cost for a home nurse, and would allow a child the option to be in a community setting. There's lots of great research and references of other states and other journal articles that have been written about this. So we're happy to share those resources as well, but we look forward for opportunities to talk with more leaders and work on having this legislation considered. It's really important that this portion of our children with special needs also have inclusion and access to the childcare that they and their families need.
Well, thank you so much for sharing that, Lisa. Again, these slides are going to be made available after the webinar, so you have a chance to read through all of that, all those details and really cool information. And our presenters will provide a list of resources that we can include in the follow-up email as well. So we're going to jump into our panel today. We're joined by panelists, both Lisa and Kari are joining us, but also we have Katie Walton and Lena Scales. Katie Walton, Dr. Walton is Associate Professor in the Department of Psychology and the Department of Psychiatry and Behavioral Health at Ohio State University. She's also the Director of the Nisonger Early Learning Program, which provides early education and early intervention services to young children with and without disabilities. Dr. Walton's research and clinical interests focus on understanding, assessing, and improving early social communication skills in children with autism. She's also interested in supporting and understanding the experiences of family members of children with autism throughout her work. She has focused on integration of stakeholder perspectives and experiences, including actively involving autistic stakeholders and parents as research collaborators. Thank you for joining us today, Dr. Walton. We also have Lena Scales. She's a level 2 trauma responsive care trainer for the Columbus Care Coalition and currently serves as neighborhood program specialist for this City of Columbus Department of Neighborhoods. She has also worked with Celebrate One. She comes with a rich background in neighborhoods, childcare, child support services, but she's actually going to say as a parent advocate, as a parent with a child with multiple disabilities. So we're excited to have you with us today as well, Lena. I'm going to go ahead and stop sharing my screen so we can see everybody's faces. And I'm going to go ahead and advance to our next slide. Thank you for joining us today, all of our wonderful panelists. The first question I'm going to ask is, what are the main disparities that children with disabilities face when it comes to accessing early childhood education programs? And I'm going to direct that to you first, Dr. Walton.
Yeah, I think there are a number of things that have been highlighted in this presentation that I've seen both through research as well as the clinical care that we provide. I think a big one is just finding and staying in childcare. Almost every family that has come to us in our childcare program, where we have about 1/3 of our children have developmental disabilities, 2/3 are typically developing. Almost every single one has either been kicked out of a childcare program or been told that they won't be served in other community childcare programs. It's not an anomaly, it's the norm. And so I think just that access to childcare is huge. And I think the other thing that I oftentimes think about is what demands are being placed on families, even whose children are being served in a successful childcare setting. What does that look like? You know, is it just that they're not getting kicked out, but they're not getting a high quality enriched environment? Is it that parents have to come 4 times a week to take them to their therapy appointments in all other locations? So I think that integration of needs for families of kids with disabilities and making sure that kids are getting a truly enriching, high quality early childhood environment and not just somebody who will let them stay in the room are really important things that I see.
Thank you for sharing that, Dr. Walton. Kari, I'm going to pose that same question to you. What's your perspective?
Yeah, I couldn't agree more. I think the barometer for success is finding it. And so I feel the same way about other things in the developmental disability community. Finding employment is not enough. It's finding meaningful employment, finding meaningful childcare, authentic, inclusive childcare. These are things that we should be expecting. But right now, and the data points to this within our report and surveying, is even finding a place that will accept your child is the barometer for success. And oftentimes, like survival for a family to earn a living and to keep food on the table. And so it's the data is already out there around poverty and families who have children with developmental disabilities. And it's not surprising when you see data like this in which you know, people are being turned away even before any needs are being discussed. Within the Down syndrome community, we get calls consistently from families who just have a newborn and they mention Down syndrome on a call, and they're saying, it's not that we don't want to, we just can't safely meet your needs here. And so these discriminatory practices, oftentimes I don't really feel like are malicious necessarily. I think there's some fear, these things. So I'm really not trying to point fingers at a particular childcare program, because it's a universal issue and in some ways a universal fear, and we need to break down those barriers, which is why I'm excited for OCALI's work and the Ohio Promise work and just educating these childcare programs, because some of it I think is adaptable. But when you have a child who isn't ambulatory at the same age as other kids, isn't toilet, potty trained at the same age as other kids, those two things alone are a huge barrier if we can't find childcare programs that are willing to accommodate that.
Yeah, thank you, Kari. Next question I'm going to ask is to Lisa. You talked a lot about medical needs and kind of some examples of challenges families encounter, but can you provide some other examples of challenges families encounter in accessing childcare for children with disabilities? Lisa, you're on mute.
Sure. I think everyone's talked about the finding placements is the top thing. I think there's also a lot of confusion around how to access some of the resources that are existing. Job and Family Services has a double the rate funding that's pretty simple to fill out with a form and to get approval for, but childcare providers aren't aware of it, families aren't aware of it. So I think that some of it is, just access to the resources that are existing. And then also I think trust is really difficult for families when they're met with so many questions and kind of like a glazed over deer in headlights look from the provider who's not sure if they can provide the services, that doesn't give the parents a warm feeling that would be a good place. So I think we really need the training, the competencies for the providers and for the providers to know where to turn. I think all of that's going to be very helpful with OCALI. Transportation is another barrier for the families that I work with that transporting the child means also lots of equipment, a wheelchair, having reliable transportation to get there. So in some cases, that's a real barrier as well.
Mm-hmm. Great. Thank you, Lisa. Lena, as a parent, what would you say are some of the challenges that families experience when trying to find childcare for their child with a disability?
Well, good morning, and I believe the subject experts have hit them all. Really, for me, it was finding a location that would accept my daughter, who has hearing and speech delays, multiple disabilities, intellectual disabilities. She has a PD repair with ENT issues, so that creates a lot of congestion. So you can imagine the concern that was in places post-pandemic, and just being able to be in those spaces where she can get therapies. I reached out to her organization because I couldn't find a center on my own. They provided me a list of 7 organizations. I called all 7 child care centers, all told me they did not have the ability to care for my child. It was heartbreaking. As I'm a full-time employee, I'm over the poverty level, and I just want my daughter to be in a safe space. I went into one location, and their concern truly was that the other kids would pick on my daughter. And I was like, wow, like that never even crossed my mind. I was looking for peer models and looking for this inclusive space, and that was their concern. And so I've heard a lot of discriminatory language that was just heartbreaking and wavered my trust in child care centers as a whole. And then when I did find a child care center, it was only 3 half days. So back to what Lisa talked about, that transportation. Now I'm in the middle of my workday trying to find transportation to secondary child care, which puts stress on family members. Honestly, when you do not have a child care center to go to, you kind of put unrealistic expectations on grandparents, on aunties and uncles to stand in the gap. And it can waver family relationships. So I applaud the individuals who talked about the stressors that we have. But it's just really, like they said, accessing and being able to stay there. Because I left a center that was really good for my daughter because they provided the therapies. We didn't have to pick her up in the middle of the day and take her anywhere. There was consistency. But when we were offered another space that was 5 days a week, 7 hours a day instead of 4, we jumped at it. For convenience, it wasn't the best place for my daughter. And it showed in her attitude and how her skills, they digressed.
Thank you. Now, I want to point out before we move to the next question, you said the content experts hit the nail on the head, but I just want to point out that you're also, as a parent, a content expert, Lena, and I think your experiences and what you just shared is some of the most important things that I think everybody needs to hear on this call today.
Thank you.
I want to pose another question to you, Lena. Can you share some of the positive outcomes of inclusive childcare settings?
I believe it starts with just this space where my daughter has Down syndrome, and being able to be in space where she can develop her social skills and build meaningful relationships with peers with disabilities and without is important to me. And when you have an inclusive childcare, you have that. You have centers that recognize their implicit bias and don't automatically see my daughter and think she can't learn, she can't do group presentations, or she can't participate in social settings. They recognize the strengths and preferences that your child has when you go into those spaces. It's the difference between going to pick up your child from childcare and here. We noticed that Sydney is having a hard time after lunch before the nap. And we want to sit down and talk about what we can do to change the environment versus picking up your child and hearing Sydney had another bad day. It can be defeating. So when you have those inclusive childcare centers, they serve as a part of the village and really help set your daughter or your child up to be a high-functioning adult.
Thank you, Lena. That was very powerful. Thank you for sharing that. Katie, I want to kind of switch that question to you and your work at the Nisonger Center and your early learning program. What are some positive outcomes that you guys see from your inclusive setting?
Yeah, I mean, I absolutely agree that this is beneficial not just for the kids with disabilities, but for the other kids who are there too, who don't have disabilities in so many ways. First of all, in just, recognizing that this is a part of their world, right? Disabilities has always been a part of all of our worlds. And the only reason it doesn't feel like it is because we're not giving opportunities to people with disabilities to be in their communities. And so when I see 2 and 3 and 4-year-olds, playing together, learning about each other. My favorite story of one of our little 2-year-olds is they're all playing feeding babies, and one of them's got their shirt up and they're feeding their baby through their feeding tube. It's just one more thing that's just a range of normal things that kids do. And I love that so much, and to be able to keep that mentality. And I think one of the other things to keep in mind too is that there are many people with disabilities who may have needs throughout their life, but also disability is not static. We have so many children in our setting who may enroll in our setting as a typically developing peer and ultimately end up receiving services at some point. We have other children enroll who are in early intervention and end up not needing services by the time they're heading off to kindergarten. And I think having truly inclusive settings that can meet needs for a range of children means that it's not you got an IEP and now you have to leave your childcare, or you don't have needs anymore and now you have to leave your childcare. And I think that the rate of children that we identify early with autism and other needs is probably extremely high because we've got skilled and trained eyes on them too that are allowing children to get that benefit of early services that they might be missing out on if they weren't sort of around those professionals who really have high knowledge of disability and development. So I think so many benefits for sure, both for kids with and without disabilities.
Thank you. Dr. Walton, how would you say, or what do you think are the important measures to measure the success of an inclusive childcare program? What are things we should be focusing on?
Oh, wow. That is such a great question. And I think one that is really hard. I do think that family satisfaction is not at all trivial, but it shouldn't be the only thing. I think, do families feel safe? Do they feel supported? And those are really important things. I think that we should be considering and thinking about children's developmental outcomes, right? If we're trying to promote positive, healthy development in terms of social and communication and all of these other things. But I also worry that as an early intervention field, we've focused too narrowly on scores on a test when we think about what does a good outcome look like for kids or adults. So I really also think we need to be paying attention to broader indicators of well-being and satisfaction and community. And I'm not sure I have good measures to suggest right now because, I don't have a questionnaire to say, well, this is the one we should be doing. But I do think we need to broaden our thoughts on what does it look like to have a good outcome when you're somebody with a disability, because it doesn't just look like being less disabled, whatever that means. And functioning and ability to be independent are important things, but they're not the only things. And I think we need to remember that people with disabilities have full lives besides just how much they can do for themselves as well.
Great, thank you, Dr. Walton. So Lena, I want to jump back to you and kind of ask from a parent perspective and from in your role at the City of Columbus, how can parents, educators, and community members collaborate to ensure better opportunities for children with disabilities?
I think we're doing it right here. More often than not, we as parents don't know the resources that are available to us. And that lack of awareness results in an underutilization of those resources, right? So having webinars like this, meeting families where they're at, just recognizing those stressors that we talked about, and we might not make it to this webinar, but where are we congregating so that we can make sure that we disperse that information in those spaces and places where families are already at, but also looking up at that step up to quality. Is there any policies in the making that says in order to get that star quality rating, you must have an inclusive classroom? Because there is no diversity without inclusion. And we have to think about our kids early and often. From birth to 5, do they have a space and not be an afterthought? So I am thankful for all the people in the organizations that are in this space because they're taking those first steps. We know this webinar is not the end all, but it is a start to get people and childcare providers thinking about it. And I just want to thank some of the childcare providers that I went to, those 7, they are in this webinar today, and I thank them for being here and leaning in. This is where we start.
Thank you, Delena. Kari, in your experience in community organizing, how would you say communities, educators, parents can collaborate to promote positive outcomes?
Yeah, so I think if you look at it kind of 2 levels, because it's a multi-pronged approach with all of this, right? You look at on the ground versus more of the policy side. I think that all these parties can get involved in both ways, depending on where their comfort level is. On the ground, I think one thing that you can do is be asking questions about pulling in your EI team to come to your center or the home where your child is, which is something that I don't think families recognize that they can ask of their EI team. I think they think they're supposed to just take all the information and then they're responsible to do all of the sharing. And even just on a personal note, that's what I thought when my daughter was utilizing EI. And so I think just asking more questions about what's possible, being solution focused from the family perspective. I think it's helpful. It's awkward, but it's helpful to share the different barriers and obstacles that we're facing, because typically people do want to be helpful. So if you're like, I'm having a lot of trouble trying to cobble all of these things together, is there any other solution we can be looking at? On the ground, that open and honest dialogue is really critical. And it makes people not feel like you're asking and then not getting. It's just putting it out there. Like, this is my problem. How could we solve it? On a policy side, part of what we did prior to pulling together a survey was really evaluating what existed. There isn't a ton of data out there. In fact, right now, the Government of Accountability Office through the feds is putting out a survey that's currently available just on this very topic. And so if you're on here, please share widely, you know, with your communities, because it's something it's exciting, but there's a lot more momentum around this right now. There's some work being done here in Ohio. There's some great reports that have been developed, but by and large, there isn't a ton of data about the intersectionality of accessible childcare for children with developmental disabilities. And so one thing that you can do, whether you're a parent, an educator who's connected to parents, or community members who may be engaged with parents, is really encouraging. We don't all love surveys, but data is what moves the needle with policy and advocacy. And if we don't have that data, then we can't ask for more funds. We can't really cite the problem. It's just anecdotal if we don't have data. So that's what I would say in a nutshell. When we all have time to do that stuff, when we're not exhausted, you know.
Thank you, Kari. We're running really close on time, but I am going to pose one last final question to you, Lisa. What do you feel like the role of policymakers is in supporting inclusion in the state of Ohio, and what steps can we take to engage them?
So I think one of the most important things is for all the systems that are serving children at these ages to really come together and talk about how to work together. You know, how could DDS and the EI services available there, Head Start, Preschool Promise, the public school districts, how can we all, with childcare providers, have a network of services where systems are talking to one another, where it's easy to navigate, to access what you need. So I think policymakers can work on systems work and a lot of collaboration to help us in our communities have it set up correctly, where kids can get a lot of services in a simple way. It's really complex for families to navigate all of this. So that could be a big help. Also, licensing for the daycare centers and childcare centers that we need for the ages we need, as well as securing funding.
Great, thank you, Lisa. Well, I see there's some questions in the Q&A, and we're unfortunately out of time today. We just had so much great things to say, and I really just want to end by thanking all of our presenters, to Nisonger, to DeSacco, to Cincinnati Children's, to OCALI and the Department of Children and Youth, and to Lena for taking time to talk about this. I think one last thing I want to end on, everybody leaving this webinar, is that this, you know, there's lots of great things happening, but the struggle's not over, the challenges aren't fixed. There's still things that we need to do. And part of it is having this conversation and not letting it die out, or not letting it be muffled by all the other things happening. So I believe that Ohio can be the best place to be any child. And as our mission, as a groundwork, to be the best place to be a young child, that means every child, children with disabilities, children of different races and ethnic backgrounds, different social environmental statuses, all across the board. We believe that we can do this. So we want to commission you. And the last thing I'll end with in the chat is, if you are interested in getting more involved with the work that's happening across Ohio, if you're listening today and you want to grow your skills in advocacy for children with disabilities, our application for our Early Childhood Fellowship does go live today, and I'm going to put that in the chat. So that's an opportunity if you want to get involved and you hear some of the things that people are saying today and say, I want to do something about this, but where do I start? This is a great opportunity to build those skills and jump in and start working to make this the best place to be a young child. So thank you, guys. I will stay on, but we're going to stop recording now. I'll stay on if anybody has any additional questions, but I respect everybody's time. And have a great day and enjoy this beautiful, gray, rainy Ohio weather in January.
Thank you.